And thank you for joining us. With us here today is Dr. Kriston, and this is very exciting because you are Meadville Medical Center's 2024 Doctor of the Year. Congratulations.
Thank you. First off, it was quite a surprise. But for me, it just means the hours, the time, like the passion, everything that I put into it, that others recognize it too.
And for those who don't know you, tell us about yourself.
So I'm one of the OB/GYN physicians here at Meadville Medical Center. My first job out of residency, so I've been here 11 years. Work with Meadville OB/GYN Associates, have 3 wonderful partners, and we are kind of the mainstay for OB and GYN care pretty much from up to Erie down to Pittsburgh.
So you see everybody.
Mm-hmm.
There's been quite a wonderful history with this department. I will say that I think 2 of our 3 kids were born here. My wife has had Dr. Johnson in the past, and it's just a rich history. Coming into that, did you get a sense that it's a well-respected department?
Yes, very much so, and just the path of who has worked here. So kind of an interesting background, the 4 of us that are here now. So Dr. Maxfield, Dr. Barco, Dr. Guzik, and myself all actually trained at Geisinger. And actually Dr. Barco, Dr. Guzik, and I were there at the same time.
Wow.
Yeah, so we all actually knew each other, and then we kind of each followed each other out here with no ties to the area.
So talk about that aspect of it. What did you discover about this area that you said, yeah, this is going to be the place?
So I grew up in Syracuse, New York, went to college in Rochester, New York, and then made the jump to go to medical school in Long Island, I lived just outside of Queens. Figured out city life was not really my thing, and slowly moved my way back to a small community. I loved Geisinger, I loved the training I got, big hospital, lots of things you probably will never see again. But to be here and take care of the community, be part of the community. My kids love it and hate it. They're 6 and 8, and everywhere we go, oh, you delivered my kid, or everyone in their classroom, and it's gotten to be, Mom, did you just literally deliver everybody at our school? I said, no, just 25%. My partners deliver the other ones.
But that has to be a good feeling to know that that's the kind of impact you can have in a community.
Yes, very much so.
So the kids someday will come back to you and say, hey, we're proud of you. Good job.
Someday.
Someday, yeah. Oh, yeah. Let them struggle for a while. But so what do you love most about what you do? Is it just the one-on-one with patients? Again, it's so many aspects to what you do. Maybe break down just the various things that could happen day to day.
So I think that's a thing with a lot of people don't realize the broad spectrum of what we do as an OB/GYN physician. I mean, I operate, I'm a surgeon, I do deliveries, I do clinic, I do office practice. That was probably my favorite aspect of the area, is that I could get a glimpse of everything. I could be in clinic one day, I could be in the OR another day, I could be planned to be in clinic and still end up in the OR. So just having that flexibility of going to and from. Any given day, we cover the emergency room, we cover anything that comes through for the operating room, we cover our clinic, we cover labor and delivery. Based on the day, I could start my day with a delivery, and then off to clinic I go, and then that afternoon be doing surgery. We do take 24-hour in-house calls, so that's gotten a little bit harder to get adjusted with my kids to maybe not being home, but they find excitement in it when I come home and tell them I delivered 6 babies tonight. So.
Talk about the various ages too, because you're working maybe with somebody young, somebody older, so there's a lot in between.
Yes, broad spectrum. We technically will see anybody. I would say probably the youngest I've seen in the office for various reasons would be 8. Just because pediatrics does a lot with them at that age. Very common to have a 12, 13, 14-year-old, and then all the way up to 99. I mean, we had one the other day who was 101 that was going to come to the office for an appointment. So.
Wow. But not for delivery.
Not for delivery,
yeah,
no.
But again, that has to be just exciting that every day's a little different, and I mean, you never know what you're going to get into.
Yes, 100%, which is why most people are used to seeing me in scrubs all the time, because we're just prepared for whatever is going to come through the door.
What sorts of things, we talked a lot about delivery right now, but there's various aspects to one's health when it comes to needing an appointment. Again, annual checkups, things that when you look at like the COVID years, maybe people have put off and haven't gotten back on track. That could lead to serious health issues down the road. But maybe talk about the importance of making sure you're coming in and seeing your doctor on that regular basis.
So a lot of what we do is maintenance, it's screening. Mammograms should be done yearly after 40, your pap smears yearly, every 3, every 5, depending, but just to be there every year for your exam. And I agree, COVID definitely cut that number down. And it was difficult because those patients, it's hard. Maybe you can talk to your family practice doctor over Zoom or video conference, which was the new thing during COVID, to talk about your blood pressure meds or diabetes meds. It's hard to do a full female exam and not have them in our office. So people were definitely lacking. We've just, I feel like 4 years later, started to get on the rebound where people are getting back into the swing of things, getting caught up on everything. But it's very important. We screen from cervical cancer, ovarian, breast cancer, uterine cancer, all the female. It's just really important to be in there for your yearly exams.
And the technology, I know there was a lot of investment into better imaging equipment and things to help with a lot of that diagnosis. And it's amazing what has changed in the last 15, 20 years.
And everything from cytology and pathology with pap smears all the way to our breast imaging. So for starters, with our cytology, patients will come in and, when my insurance company says I need a pap smear every year, actually not everyone does. And the reason is because our screening has gotten so much more precise that we now screen for the HPV virus along with the actual pap smear. And so we can comfortably go 3 years, 5 years. But if you're there routinely and getting all those exams every year, that we feel comfortable doing that. If you haven't seen us for 5, 6 years, things change. And then breast, same, imaging has come a long way to do 3D imaging, even 4D with some of our ultrasounds, and be able to get a better image, catch breast cancers much earlier, which is much more treatable when we can catch it that much earlier.
And I guess the opposite to that would be if there is something that is shown, maybe it's not waiting a year, maybe it's, hey, let's see you in 3 months or 6 months, just to make sure. So there's that part of it too.
Correct. That follow-up to get them in even sooner if need be.
What are things you hear from patients like, maybe I don't want to schedule it because it's uncomfortable, or like that? Do you hear? Is that a basic thing you do hear? Are there other things that patients say to you?
We do. We hear that a lot. I think that medicine in general also has kind of gravitated towards more of a female physician, and you see a lot more females in medicine. And I feel a lot of patients feel more comfortable with us as females just because we can relate. We've been through the physical of delivering a baby and the annual exams, and just giving them that comfort. I've had patients come to me in the office, and the first visit is literally just a conversation. Like, okay, we're not going to do anything today. Let's just talk. And we kind of talk our way and build them up to the point where they're able to come in and see me for what they truly need for the exam.
So you mentioned the age group, but it's primarily the teen or preteen that you're starting to think about, okay, we need to make sure that we start scheduling appointments. Is that talking to their primary care physician? Is it calling your office directly? How does that start?
Usually more so with their primary care. We have a wonderful relationship with the pediatrics office in town too, and they tend to gravitate them towards us. 21 is the recommended age for pap smears to start, but a lot of them, when they start having birth control conversations, the pediatrician will start sending them our way. So to get them in early, that, because those first few visits up to 21 are literally just conversations. So if they've spent 6 years getting to know us, coming in once a year, just having that conversation about, their life and school, and then getting them set on birth control, and then they're better prepared and better connected, so that when those lot more personal exams start, they feel much more comfortable with us.
Are there private conversations? Because sometimes, parents are saying, hey, I don't think my kid's doing something, and maybe they are, and they're not comfortable saying that. I mean, are those conversations that your patient will have privately with you, or do you recommend parents, be there with their kids?
Kind of feel it out. Also do a little of both. So sometimes we'll start with a patient alone, and then maybe mom will come in after. The other thing with this small community is more often than not, we take care of mom. So the mother already has that comfort level with our office. Maybe I'm not her physician, but maybe Dr. Maxfield is, but to know that that group has already taken care of her. Dr. Maxfield's been practicing for 22 years now, so she's actually taking care of kids now that she delivered. So to see
I may have one or two of those kids.
Probably. Just so see those come full circle. There's just so much more, again, that small town feel. I remember when I was in med school and you'd hear about family practice where they would, take care of everybody, all the kids and the parents, and now we kind of have the same with the females in the family, but have the same aspect where we take care of the sister, the mom, and again, if we don't, one of my partners does. So just have that connection. They just feel a lot more comfortable typically talking to us alone, which is nice.
Do you see cancer rates increasing in youth? Is it consistent from the last 20 years? I mean, again, for those thinking, well, I'm young, I don't need to really worry about that till later. No, things can pop up, and it is important to have those annual checkups.
Honestly, I think that with our screening modalities getting more advanced and patients feeling more comfortable, the most recent generations I feel like are wanting to get answers, wanting to come to the doctor. There's a lot more autonomy involved with those generations, kind of really like, not just, oh, this is what the doctor said, but making that plan together, where I feel like some of my older generations, were in the thought process where, well, I was done having kids, so, they'll come to see me, now they're 75 with a problem, but they haven't seen a gynecologist since they were 37 when they had their last kid. So it's actually more that generation that I find kind of has that gap where other patients they're on top of it every year.
Yeah, so there's never really an age where you shouldn't stop, or stop. You should keep going, and again, that's a conversation that they're having with you or your partners to just make sure that those are scheduled and routine. And
that's a question a lot of patients have too. They'll come to see me and say, well, when am I done with this? Like, I love you, but when am I done seeing you every year? And a lot, we'll have the patient that come in who's 50 years old and not in the best of health, and maybe on oxygen and in a wheelchair. And then I have the 85-year-old who, after she leaves, she's going to the gym and she's watching her grandkids. So it's a big spectrum of how they present, and there's no real endpoint for like breast screening. So typically in our 80s, I start having that conversation of, it's a screening. If we found anything, would you do anything? And that's usually when they start having the conversation about when do you stop colonoscopies. Pap smears do have an endpoint. Those stop at 65 as long as they've been negative. So, but I always tell them not a reason not to come every year after that, because there's other parts of the exam that we do.
What do you do at the end of the day to unwind? I mean, it sounds like it's a pretty hectic day, and sometimes that could probably go past, the 5 o'clock time. So what do you do to relax?
So my husband would probably tell it more of my midlife crisis recently, but the last 2 years I picked up running and CrossFit. So I do both. And then usually, honestly, last night we were at soccer practice. So I'm quite often running around with a 6 and 8 year old at different practices. But for me, it's running. That's kind of my zone out.
Is that the sport of choice in the household right now?
Soccer?
Yeah.
Yes, we're in spring soccer. We hit everything. We just finished wrestling. We're into soccer.
And that's a grind. Wrestling.
Yeah, it was his first year, so we just kind of filling out the waters of that one. But
did you play any sports?
I actually played 4 years of college tennis. So I went to college and played tennis. That was kind of my out to get through all of my pre-med requisites. I used tennis as that. But I also did soccer and lacrosse. Actually, I coached the kids' soccer team too.
Oh, that's fantastic. Mm-hmm. So that's a nice way to kind of unwind, right?
Yeah.
When you look at those athletes, it's got to be kind of amazing, right? To see okay, these are the future, and I'm sure you get that a little bit with working with maybe a younger couple, starting a family, and then getting older and seeing them down the road. I mean, that has to be. I mean, you're not at that age yet, but We could pick on maybe Dr. Maxfield a little bit.
Maybe, don't tell her that.
No. But that has to be, again, going back to that family concept, is they trust you. You know these families. You don't get that everywhere.
Right. And that's even coaching soccer with my kids, coaching them and having kids I delivered on my kids' team and knowing their parents. And yeah, it's, again, that small community feel.
Well, what's next for you? What's next for the practice?
So we just keep building on where we're at. Unfortunately, small community hospitals with a private, like with an OB/GYN that we're not, global, nationally owned, they're kind of a dying art. So, like I said, I started 11 years ago and watched Grove City, Titusville, Greenville, all of those practices shut down and stop delivering babies. So we're definitely busy, and we like it that way, and we want to stay that way. We've expanded the office to have the 4 of us, and then we actually have 3 mid-levels in our office too.
Oh, wow.
To help us with the office space in case we are needed on the floor. We are now covering out in Titusville, so we see patients out there. We're going to try to expand now to Alden Street and kind of move over with the community health. And then I actually sit as the director of family planning as well. And so I do a big part of the family planning in town as well.
Well, if anyone is looking for more information, do they call your office directly? Do they talk to their primary care physician? How does that work?
Either way, we can get internal referrals from primary doctors into our office. We also welcome anybody to just call, and we will get them scheduled. But like I said, between basically 7 providers in the office that can see patients.
All right. Dr. Jessica Kriston joining us here. Thank you so much for your time.
Thank you.
Real pleasure. All the best. And thank you for joining us.